Hey everybody, welcome back to Skin, Self, and Everything Else. I'm Brandon Mitchell.
And I'm Dr. Ellen Turner.
Conversations, what are we talking about?
It's all about men this week. Last week we were talking about menopause. This week we're talking all about men stuff. Yeah.
I like that topic.
Yeah. So Brandon, did you know that men, their top 3 issues when it comes to aesthetics and skin, it's hair loss, eyes, and jawline.
That must be your typical man, because if we're talking about me, I have a lot more than just that.
That's your typical male.
Okay, well, I like to make everything about me. No, I would agree. I would wholeheartedly agree, because you know what? Honestly, those literally are the 3 things that I want to improve on the most about myself, honestly. Because as we get older, but you know what? As men get older, I do feel like men age more handsome as they get older. Not for 99% of the time, but I will say that is where I'm showing signs of aging the most, is hair loss in my eyes.
Absolutely. I mean, that's what, and when they are pointing to, their face, I think that's a cue to you as the provider who is doing the consults. That means that they're talking about their eyes. They're pointing here, they're talking about under their eyes, or if they're pointing here, they're talking about their jawline.
Yeah.
So we'll be talking about some actual real treatments that, if you're a man listening today, come on in, we can fix this.
We can. And aesthetic stuff, cosmetic stuff should not just be to the females.
No.
And a lot of men, I don't want to speak for everybody, but a lot of them think it's like a feminine thing to do, but it's really not. I mean, I think everybody should take care of themselves in some way or another, doing some sort of aesthetic stuff, right? But a lot of men do shy away from it, I feel like.
It's something that if it makes you feel better about yourself, you should do it. Or I've had men now, and I'm so glad that they're talking about it with me, is if they're in the workforce and they have been for a long time, let's say they're in their 40s, 50s, or 60s, and they still have every desire to stay in the workforce and be at the top of their game, but the new guys are coming in. And they want to still look like they're at the top of their game. So they want to have those treatments that still make them look younger or more attractive.
Right.
Without making them look like they've had something done. That's the last thing they want, is to walk in and be like, what did he have done? They don't want to look like that. They just want to look like themselves, only a little bit younger, a little bit more attractive, so they can stay again at the top of their game in their professional environment.
I feel like, and tell me your opinion in this, I feel like that when men, it's easier for a woman to get a lot of stuff done and look a little bit overdone. It looks really strange on a man.
Oh, yeah.
Would you agree?
Yeah.
Because go ahead.
I was going to say, I think especially in Texas, it's just, we do not like the overdone look. You want it to look natural. I think some markets like Miami, especially in LA, you can get away with that overdone look, and some people want that look, but not in Texas. It's just not even really tolerated.
And I just want to let it know, honestly, being a man and getting stuff done.
Yeah.
Especially when I'm doing a consult and I try to tell people, if it's a man,
right,
I say, look at my face. Do I look overdone? Because I think that's the fear, especially in men,
right,
that they think coming in here and they do any sort of injectable or something, it's going to, make their face look deformed or make it more feminine.
Right.
But people have to remember that when we're talking about filler,
yes,
I mean, a syringe of filler,
it's a teaspoon of sugar.
That's what I'm saying. It's a teaspoon, right? Yeah. So I understand the fear, but it's really not going to, you can overdo it. We see it all the time. Yeah. But in terms of never having done any kind of aesthetic treatment, and that's your fear as a man coming in here to do it, that you're going to be overdone.
Yes.
number one, that's why you need to go to a good injector like yourself, because they're walking billboards for us. We're not going to sit there and make someone look overdone, make them look plasticky. As a matter of fact, I have literally seen you in a gentle way, because it's the right thing to do, turn people away that are already overdone, that may have come from somewhere else.
Yes.
So I understand the fear in that, and I just think that a lot of men, I hope that they would get over that, because there's a way to get freshened up without even looking like you had anything done. And people will actually look at you and say, I don't know what you've done, but you just look more rested, you look refreshed. And that's the goal.
Exactly. So let's talk about hair. Did you know it's Alopecia Awareness Month? So alopecia is just a fancy word for hair loss.
And let me tell you, then can my car get treatment? Because I got a defective paint job on my car, and the paint's been coming off. And I've been telling people that my car has alopecia. It's this ongoing joke within the office, honestly. And so, but anyway, no, all jokes aside, I did not know that. But I want to talk about the treatment that I got today.
Tell us.
I had my very first exosome hair loss injection that you did. And I have to say I was pretty nervous going into it.
You were?
Extremely nervous, because, I don't know, you picture your scalp and you're thinking, oh my God, I think that's going to be a tender area. I was, and I'm not even trying to exaggerate this, I was overly surprised at how not painful it was at all.
Yeah.
I really thought, out of a scale from 1 to 10, I'd probably rank it a 2.
Yeah. It's not a bad treatment, and it's over so fast. I mean, literally,
it was 3 minutes. Yeah. No, that's even too long.
That was, I think that was the whole video.
The whole video.
We did it for our training site for drellenturner.com, and I think the entire video with me talking first, plus doing your injection, plus maybe the little massage we tape, was all in 3 minutes. So
I was really surprised. I'm so excited about it, because, as we mentioned before, for men, hair loss, eyes, and jawline. Because when I look in the mirror, that's where that's where the shock the most, is the hair loss, even over the eyes.
Yes.
It's a very hard thing to go through. I mean, it's especially when you're 47 years old and you're single, you think life's over for you. Because them gay men out there be picky.
Well, think about this, Brandon. What if you're a woman and you're 37 years old?
That's true.
So it's painful for both sexes. But I think now we're coming to an age where men deserve to have hair, whatever age they are.
Yeah.
So that's a great treatment. Exosomes. So what are exosomes? Let me kind of compare exosomes to PRP so our audience really knows. So PRP, we've talked about PRP, I think, a little bit on the podcast, but just to be clear, PRP is platelet-rich plasma, and that's what you get from inside your body. It helps to heal wounds. When you have like a wound, that's what allows the body to heal. When you concentrate it down and re-inject it into the scalp, we've known about that through Dr. Jeffrey Rappaport. He did some studies in the United States. This was probably about 8 or 10 years ago, and showed us that you have to inject them 4 times, spaced a month apart, and then re-inject every 6 months to get hair regrowth or regeneration in androgenetic alopecia, or male and female pattern baldness. We've known about this in Asia and Europe. They've been doing platelet-rich plasma for like 25 to 30 years, a long time. There was a lot of skepticism in the U.S. marketplace because people were doing it all wrong. They were injecting PRP once or twice, and then they said, oh, it doesn't work. Well, that's because
they weren't getting enough treatment.
They weren't doing the protocol correctly.
Right.
And Dr. Jeffrey Rappaport was the first one who did the protocol correctly. And then he went around the U.S. training other physicians. I trained under him in Austin. He got on Good Morning America, and he spoke on Good Morning America about it. But the point is, PRP does work if it's done properly, but there's too many variables with PRP. You have to consider the patient's hormones. You have to consider the patient's fluid levels. I had a patient that was doing a great job of hair regeneration, and we were doing it consistently every 6 months. And then all of a sudden he came in one day and he was like, I don't want to do it anymore. And I said, why? And then I looked at the top of his head. He had lost half his hair. And then I said, no, we got to do a lab workup again. And I always do a lab workup when we first start. And then if there are changes, like negative changes, and sure enough, I did. He had Hashimoto's. He had autoimmune thyroiditis. So a different thing was going on, is my point. It wasn't just androgenetic alopecia. So
does one's diet and stuff, honestly, like if someone has a very poor diet, they never drink water, does that affect the results of using their own plasma if they're on a poor diet?
Yes.
I've heard that too.
All these variables can play into PRP. So I could see it when I was injecting. Like you might see one yield on a patient would yield, 7 or 8 cc's. The next time I might get only 3 cc's. So a very small amount.
And there's a difference in the color too.
There's a difference in the color. Sometimes it'd be a really, really pale yellow. Other times it would be a really dark gold.
Yeah.
So, long and short, when they came out with exosomes, which exosomes are subcellular particles that essentially draw like a magnet to the area injected, in this case, scalp, the growth factors that are already circulating in our body. So there's a one positive thing right there. Now you don't have to have the patient get injected for the withdrawal and then re-injected with their own PRP. You're taking a specimen, another outside product, and now you're injecting it into the scalp. So you didn't have to get 2 blood draws. You just got the one injection into the scalp, right?
Yep.
So that's one advantage. The other thing is it's much, much more potent and much more powerful, more concentrated than PRP is. So you essentially do 1 injection equates to 4 injections of PRP. So that's a second advantage. The third advantage is you do it essentially once yearly, whereas PRP you have to maintain twice yearly. Now, I have patients, they ask me all the time, how many injections of exosomes will I need if I have X much hair loss? Well, everybody's different. Androgenetic alopecia, some people start at stage 1, other people start at stage 3. And so it depends where you start. How bad are you? It's just like with any other aesthetic procedure. If you start when you're 30 doing Botox, then you may need such and such amount, versus if you start at age 60, you may need a different amount, right? It's the same thing. So you may need more product to get you where you're trying to go with exosomes, and then maintain thereafter once yearly.
I'm so excited to see my results.
Yeah.
I mean, I think out of all the aesthetic things that I do, and we don't do very many to ourselves because we're providers, we treat ourselves last. It's just the way it goes. But I'm just saying, out of all the things that I've done, filler and everything, I'm the most ecstatic to see my results in this, because I really do. I can relate to people out there with hair loss and what it feels like. It's very unsettling. And I love that you said that about women, because honestly, that is devastating to a woman. Yeah. And so just thank God that we have providers such as yourself that do these kind of treatments.
Yeah.
But I just wanted everybody to know, because seriously, I really did expect it to be so very painful, and it wasn't.
It's fast, it's easy, it's relatively painless.
And guess what I did right after I got injected?
What'd you do?
I had Iris put in my prescription for dutasteride.
So let's talk about that, because that is another great medicine that a lot of people don't know about. So if you're a male, you're a great candidate for dutasteride, and it's a prescription. So you come in, you have a full workup done, and you can get a prescription for dutasteride, especially if you have what I suspect to be male pattern baldness or androgenetic alopecia. So yes, that's what you're going to start. And when you pair that combination, exosomes plus dutasteride, oh my gosh, that is a winning combination.
And I'm going to one-up you. Guess what else I'm going to do? Extresse on top of that.
Oh my gosh, you're doing like the trifecta there.
I'm telling you, because it does. It's
doing it.
I cannot wait. It's the one thing that bothers me, and I'm so grateful that you chose me today to. I was excited about it.
Yeah, you're the guinea pig. He's trying a new form of exosomes. We've done exosomes for like almost 8 years, I think it is. But in any case, this is a new one by the people who make Extresse, and this is going to be launching in February. So we've been privileged to get some of their product, use it on you, used it on another patient, and we're trying it out. And I think this is going to be the first ever FDA approved exosome product. So right now you can only get exosomes that are the laboratory is FDA approved. You get it from an FDA approved lab. And right now we get ours from Thomas Lab, but I think this actual product that we're using today is going to be the first ever FDA approved exosome product. So I'm really excited to see your results.
I am too.
Yeah. But yes, don't be afraid of dutasteride if you're a male. We do give it to females as well who are postmenopausal. This kind of goes back to last week's podcast on menopause. We can give it to females with androgenetic alopecia as long as they're postmenopausal. So that's another great treatment.
Well, I'm doing the trifecta. I will keep everyone updated on my results because I am ecstatic.
Yay.
I'm so excited.
Let's talk about the eyes. I think the eyes are a great area that males often want to talk about. Hey, doc, what can you do for this area under my eyes? I've really gotten away from filler. And you can tell everybody why, Brandon. Why have I gotten away from
Well,
filler?
and I'm going to tell them why, but I'm also going to tell them, because of what I've observed.
Yeah.
The thing with under eye filler is everyone seems to think when they have dark circles and bags as they age that they all go to filler. I feel like that's everyone's go-to.
Yeah.
But I'm finding, including yourself, more and more providers are staying away from it.
Yeah.
Number one, I don't think I've ever seen filler in tear troughs that look 100% acceptable. It just doesn't come out looking that good. It's hard to make that perfect because that skin is so fragile. It's so thin. So it's very hard not to make it look lumpy and just, and create divots.
Yeah.
Another thing is the risk factors involved with injecting around one's eyes. I mean, the risk of vascular occlusion alone.
Super high.
All the risk blinding people. I mean, it's just so scary. And so I love the fact that and I know for a fact of 2 other plastic surgeons in the area that don't even do filler in their tear troughs anymore. It's just too risky. It doesn't look great.
Yeah.
So that's why we have different modalities and different stuff that we can do now, such as M-Face eyes, right? They just launched those under eye applicators. We've got before and afters that prove that it works. It takes care of dark circles. It helps with under eye puffiness. It goes up into the crow's feet. It's just a good overall rejuvenation of the eye that does not require any needles.
Yeah.
So I urge people, honestly, don't jump to filler. Don't automatically want somebody to put filler in your tear troughs. That's not the way to go anymore. It's just too risky.
Especially when you have good alternatives.
Right.
To it. And then the other thing that we love to combine with M-Face eyes is PRP under the eyes.
Back to PRP.
That's where I love it. You could also do exosomes, but it's just now you're really starting to go up higher in terms of the cost. But if you're willing to pay for it, we can put it in. And I use a very, very tiny micro cannula, again, to just be really safe and ensure that we're not going to hit any kind of a little vessel there. And I just put a very tiny guide needle in and then replace that with the cannula and then insert the PRP and just flood that zone.
It's such a pretty treatment. It's such a pretty combination to do your own body's plasma with the M-Face. It's so natural. It's so subtle. And it's really all you need.
Right. Yeah.
And then if somebody needs a little bit of a lift of a brow or something, or crow's feet, add a little bit of all therapy in there with it. There's so many different modalities that not only we have that are out on the market that are rejuvenative. Is that a word?
Yes, rejuvenative. Yeah.
To the eyes, without going in there with a needle.
No, I agree. Yeah, and that's what males are looking for too. It's like they want things that are either once and done, or it looks like nothing has happened at all, and they've just gotten that freshened look. Or quick things like M-Face eyes takes how long to do?
Oh my God, 20 minutes.
Yeah. And they can come on their lunch break, lay down, do it, get up, go back to work, and nobody's the wiser that anything's happened. So, these things are just really incredible procedures that give a real enhanced result. Jawline. Let's talk about jawline, because I am so excited for all the things that have happened just in the last probably 2 years for jawline that literally gives a surgical look. But it's totally non-invasive. It's so incredible to see what we have accomplished just in these 2 short years.
You've done my jawline.
Yeah. I've done your jawline. I've done so many. That's the thing. It's really been cool to watch the males come in because we've gotten these products, especially hyaluronic acid products, so dissolvable products, but they have such a high, what we call G prime, or really like viscosity, that are mimicking of bone. So you can put them right along this jawline, you can put them right along the cheekbone if you wanted to, but they just enhance this jawline. The male jawline, it's just very squared off. The chin is very squared off. It's just very sharp, and that's kind of the aesthetic look that we want to see in a male. Very different from a female, that's, the softer, the oval face or the sweetheart face. That's the more desirable faces that the female wants, but the male, totally different. So that's what you need to aesthetically establish with your patient before you start injecting. You don't want to assume anything. You want to ask and make sure, hey, you want a masculine faces, and usually you can assume, right, but you just want to make sure this is what you're going for. And then for the fillers, that area, I always like to use Volux or Lift because of their high G prime.
Right.
And then if you see a lot of fatty area there, from an injection standpoint, we can use Kybella, which will dissolve that fat under there and make that bony jawline even more defined. And then there's also the M-face. Here we are back at M-face.
Yeah, because they have submental.
Yeah, that submental, which, again, if they want to stay away from the needles, not a problem. That's a needleless technology. So we have so many things in our toolbox now that we can use, but never forgetting that if we want to really enhance the jawline, we do need to look at that mid-face and make sure first correct the mid-face, and then we go down to the jawline. So we always have to make sure that we're correcting both if that's needed.
Another thing that's very common for men, because you fixed it in my face, is losing fat pads.
Oh, yeah.
You know how
that
you
little,
can do that little fat
pad correction.
And you know
there.
what's weird? It's like whenever I was losing my fat pad, I can literally feel it. Do you know what I'm saying? I can feel the loss of fat there.
Yes.
In the older that I get, I can still feel it. It feels like a divot.
It's like you put your thumb or your second finger there, and you can feel that indentation, especially because you work out so much. And that's the thing about males who are runners, or they're kind of gym rats, and they just work out so much that their fat pad, literally, it's not, they're getting separation of those 2 fat pads there. There's 9 fat pads in the face, but those 2 right there, that mid face, that's where they start to see that separation, because they can't hang on to that fat there. Yeah, so you can really just reestablish that little kind of bridge there I usually like to use contour there, because contour mimics that fat.
It does. That's what you put in my... Can I tell just a quick story?
Yeah, of course.
Because this is hilarious that you're reminding me of. Shout out to my friend Vonda, and we hope to get her on this podcast because she is an amazing injector. She's been doing it for so long. But she's up in the Sherman area, works for a plastic surgeon. But the reason why that I'm bringing her up is because when I worked with her before I came back here, she had asked me to go to it's called ISIS. I think it's like the nurse convention that all the aesthetic nurses go to, and they have like all of these seminars and all these things, to re-up you on your knowledge.
Right.
And I'm an esthetician. I'm not a nurse, but she's like, oh, it doesn't matter, blah, blah, blah. And so I called just to make sure. Anyway, nonetheless, they said it was okay if I go. So I went, and then she had pre-signed up for all these classes, and there was one class that she couldn't make it to, and she begged me to take her spot because she felt disrespectful not showing up and the chair be empty.
Oh, yeah.
So I go to this class, and the reason why I'm telling this story is because we were pointing at fat pads.
Yeah.
It reminded me of this story.
Yeah.
I get in this class, and there are cadaver heads all in this class. And I kid you not, I walk in, and there is this head on the middle of the table.
Yeah.
I'm trying to maintain composure.
Oh, yeah.
And then when the class started, everybody's getting scalpels and like hacking at this poor head going, and it was like, it was cool once I matured up, because I was being very immature, because I was like, what in the hell is happening right now? There's a head on this table, and the first thing I thought was, I'm going to kill her for making me freaking see this.
I'm surprised she didn't like kind of just give you a heads up.
She did not. Well, I think maybe she did. I can't remember, but I don't think it registered.
Yeah.
But when I got in there and they pulled back that sheet, because they're covered up in the beginning, and I saw that head, I was like, it was very...
disheartening. It was so shocking.
Well, it was just very shocking, but I'm going to tell you what, once I got over the shock, it was really amazing.
Yeah.
Once you get into it, to be able to see the different layers, the different fatty, all the things.
That's incredible.
And I remember they made these different color, they had different color fillers.
They inject, or they put the colors
so you can see
in the
if you
fillers.
injected.
So you inject it, and then you start to do the anatomy dissection, so you can see where did you put the actual filler. Did you put it in the right plane, and so on and so forth. Those are really expensive to get those cadaver heads, and those courses normally are extremely expensive, so you're very lucky to get
I am lucky. I don't mean to sound immature about it, but I just when you were pointing at the face, I was like, I'm telling the story.
You were thinking of my cadaver head. That's what you were thinking of. You're like, oh, imagine Dr. Turner as a cadaver.
Well, and then I got home and I looked at my driver's license and it says donor. I'm like, oh my gosh, my head's gonna end up on one of these tables.
It
could. But anyway, no, honest to God, it was really cool. I'm blessed to have been able to sit in that class, but I have to tell you, I was not prepared mentally
for that.
Yes, and Vonda was laughing so hard. She was, oh my goodness, it was hilarious. Anyway, I had to tell that.
Oh my gosh.
But yes, many things to do for a man. There's so many good things, so many good treatments, very subtle treatments that are going to rejuvenate you, that are going to make you feel better about yourself, feel more confident in the workforce, all the things. And I promise you, if you go to a good injector, like here at our office to see Dr. Turner, you're not going to look overdone.
No.
You're walking billboard for us. We are not going to have you looking like some people maybe on the West Coast. No offense. I'm just kidding.
Miami for sure.
Miami for sure. But you know what? If that's what you want, then you can go find that. But we're unfortunately not going to be able to provide that for you here.
Right. That's right. Well, let's talk about self some, because we have a new social media team that's helping us with our social media. And I would say that as far as grading us on our contribution to the team,
I think right now we might be at a C-.
I said a D-. How would grade us?
I'm like, maybe, I don't know. I mean, we're going to get there. Everything is.
We're going to get there.
We're trying to improve our social media, and they're really good.
They are getting an A+.
So everybody go like our social media page. We want your feedback. It's really good. They are doing an amazing job.
Share, like, do whatever you have to do to get us up. Anyway, we got an F on that Google folder thing. They're still asking us to put stuff in a Google folder. We don't even know how to start doing that kind of stuff.
You know what's crazy to me, and I'm sure other providers out there can vouch for what I'm about to say, is when you're hands-on in a treatment room and you're doing physical care to patients.
Yes.
We're not involved with computers a lot. All we do is chart.
You think?
And so the thing is that whenever you get challenged with technology, I feel like I'm so far behind. I don't even know how to post on Instagram. No. I swear to you, I don't.
No.
You have to be a video production major just to do a social media posting now, I feel like. Somewhere down the road, I got behind with the times. I don't know what happened.
It's called getting old, Brandon.
Is that what it is? Getting old. Whatever it is, I'm struggling.
Or it's not our forte. Because I just have been on the same program, my same little EMR, and now that I know that system, I can only work in that system. So
let me tell the story of this past week that I went and I was feeling anxiety bad. And I still struggle with that sometimes, like the anxiety level. Sometimes I just wake up in that and you can't shake it.
Yeah.
And, I literally was, my head starts racing, which I'm probably not doing enough meditation. I don't know. You know what I mean? Some days just get like that. And this week was it was bad in some areas with it's nothing that specifically that happened. It's just, I go into this space to where it's like, I can't sometimes, it's a spiral and I can't bring myself out of it. And so I came in here, and as you know, I sit in your chair, and I was like, Dr. Turner, I need words of affirmation.
Yeah.
I was like, I need words of affirmation because I am on the struggle bus mentally this week.
Yeah.
And so you, as you always do, and I'm so blessed to have you in my life. I'm not even kidding you. You talked me off the ledge. I honestly, I don't even say that to be funny. It's the truth, because you talk me through it. You talk me off the ledge, because I do suffer from really high anxiety, and since to be honest with you, since I got sober, I never realized that I had this much anxiety. I never knew.
Yeah.
Hence why I stayed intoxicated a lot. And I didn't realize, I always thought I was this real outgoing person. And then I had found that when I don't have the liquid of courage, I get social anxiety. And that's disappointing, because I never knew I was that way, because I always had something to help me through that,
Covered it up with something else.
My point with all of this is literally, I was in the car, and I was on my way home, and that's when I do my best thinking. I don't know about you, but I love the commute back and forth to work. It gets me mentally prepared for the day, and it also gives me a chance to unwind before I get home. It's my thinking hour in the car, and all of a sudden, how you hear voices in your head? We really do need to tune in to some of the voices that we hear and learn proper discernment on which voices that you need to hear, and which voices that are not from a higher power. But this voice came in my head, and it was clear as day, and all of a sudden this light bulb went off, because I was in the car, I was driving home, I was beating myself up, saying I didn't do this good enough, I didn't do this good enough, oh my gosh, I didn't get this done, going down this spiral. And all of a sudden this voice in my head goes, I need you to stop for a second, and I need you to listen very closely. And it said, how you treat yourself is how you treat other people.